Hi, my name is Miranda Lane. My presentation focuses on what major factors lead to a lack of insured children in North Carolina compared to other states. I also want to focus on the disparities seen among those who are not insured. For years, the nation has been on a positive trajectory, trying to reduce the number of children uninsured, and while their tactics seem to have been working, lately data show that the progress is vulnerable. My initial assumptions about the coverage of children within healthcare in North Carolina contradicts this finding, so it intrigued me to keep finding and researching data surrounding this topic. Making sure children are insured is important because not only are they more likely to need services, but they also rely on elders in many ways. Therefore, providing increased awareness of the importance to insure children will help their families out immensely. Within the presentation, I want to focus on the main reasons that North Carolina healthcare access is lacking, such as a lack of Medicaid expansion, a overall lack of access to healthcare, lack of awareness, and negative preconceptions surrounding healthcare. And I also want to bring to attention the solutions that are beginning to be implemented around UNC. While children's healthcare coverage rates have been improving for many years prior to 2014, the Affordable Care Act pushed those rates to their lowest in 2016. A particular article from Alker and Moy Gardner explains that coverage losses are widespread within 15 states, North Carolina being one of them. One of the main factors that has led to this trend is the lack of Medicaid coverage expansion within the state. States such as North Carolina are maintaining a lack of access to affordable care and are falling farther behind due to their lack of expanded Medicaid. In the chart below from Alker and Roy Gardner, you can see that the insurance rate in Medicaid non-expansion in North Carolina is even higher than that of the United States as a whole. This can be seen in this chart shared on the screen. North Carolina is at 5.3, while the United States is at 5.2. Besides Medicaid non-expansion being a major factor for the increase in uninsurance rates, another factor is the overall lack of access to healthcare in some areas of North Carolina. Within the 2018 North Carolina Child Health Report, this focuses on the lack of access and details with the problems that surround this unfortunate situation. The article mentions that the percent of low-income children continues to decline, falling 43% in North Carolina between 2012 and 2016. In North Carolina, Hispanic and American Indian parents are less likely to have health insurance coverage than other races. The chart shared on the screen also details the disparities using specific statistics, which makes some of the patterns more noticeable. As you can see, the insurance coverage for Hispanic or Latinx is way lower compared to the Asian or whites or even African Americans. A study done through UNC Chapel Hill from the American Journal of Infection Control also provides evidence of the difference in accessibility to vaccines and other healthcare opportunities. The article points out that vaccination is of particular importance for under and uninsured children. Because these students are from poor families without access to private insurance, they may lack many of the family and financial safety nets of their peers. This quote brings to the forefront how crucial a simple vaccine is to those without proper sanitation in their homes. Within this study, it was found that there was a correlation between the number of vaccines given in an area and the zip code of the area. This phenomenon is also something we are discussing in my disease ecology class relating to COVID. There seems to be many more vaccines clinics around the areas that are more populated, more funded, when in fact, they need to be in the areas that are less funded with people that need the vaccines more. While there are still many children that lack equal access to healthcare in North Carolina, the Affordable Care Act has narrowed the racial gap and ethnic gap a little bit. For instance, according to Baumgartner, the gap between Black and white adult uninsured rates dropped by 4.1 percentage points, while the difference between Hispanic and white uninsurance rates fell 9.4 points. This decrease in the gap between races eligible for Medicaid is a step in the right direction, but there are still other steps that need to be taken. And as an article by Kenny et al. Points out, prior research has found that although participation increased, variation in participation across states persisted. The reasons for these differences seem to be a lack of awareness of the programs or of eligibility, a lack of interest in enrolling, and much more. In order to stop helping people and the millions of children and families that remain uninsured, there needs to be programs that help families understand the benefits and enrollment processes of healthcare. Overall, while there has been some action towards equal access to healthcare for all children and families, it is clear that there needs to be more awareness towards not only the programs available, but also the lack of access within North Carolina. Even though I have lived in NC my whole life, I was unaware of how many lack access to healthcare, especially children. And while there are many ads and billboards that seem to advocate for healthcare, there needs to be a reality check of how many people already have the negative preconceptions of healthcare that will not just change because a billboard with a smiling face told them to apply. It is becoming increasingly important for children to have access to healthcare because children depend on their parents for longer periods of time than they ever have before. In the near future, there needs to be greater access to programs that detail the positive aspects of healthcare as well as increased expansion of Medicaid eligibility. That way, families that truly need the service can apply for it. And that concludes my presentation. Thank you for listening.